Hello, everyone. Thank you for joining us today. You are watching Mother Doctor Nurse with Dr. Deb Levy and Sarah Hunstead. Now, I'm Sarah. Lovely to meet you. We haven't met you before. I am a paediatric nurse, a mum of two, and founder of CPR Kids. And every Wednesday, we bring you a live session on children's health topics. And I'm joined by the fabulous paediatrician, Dr. Deb Levy. Deb, for those who haven't met you before, do you want to do a quick introduction? And then I forgot to tell you what we're talking about today: allergic rashes. It's going to be really good.
Exactly. So yes, hi Sarah. It's always such fun to be with you on a Wednesday, especially in this dreary, rainy weather that we're having here in Sydney. So I hope everyone's keeping safe, because I know there's been a lot of flooding. But yes, my name is Dr. Deb. I'm a holistic pediatrician. I'm currently practicing in Sydney in the eastern suburbs, and you can find me on Instagram at Dr. Deb Levy, as you can see below. And when I'm not seeing patients face to face, I really love teaching parents, really just the tips and tricks and the practical things that we think you need to know. So today's one of those days. And exactly as Sarah said, we are going to be covering allergic rashes, because they can be a little bit confusing and they can be a little bit scary too.
Yep, absolutely, they can. And this is it's starting to get a little bit old, I think, Deb, because yes, my children have had allergic reactions. Yes, yeah, actually, no, I lie, not both of them, just one of them. But anyway, of course, because my kids have had virtually everything, I always have a story. It's just the way it rolls, which is rather convenient for this, really. It's like they were, they knew that we'd be doing, these live sessions on them. So it was convenient. But allergic rashes are certainly something that cause a lot of angst in parents, especially being able to identify them. I mean, how do you know if a rash is an allergic rash or a different kind of rash, or one that you need to worry about or not worry about? I mean, we've got enough angst when it comes to parenting already, let alone adding rashes into it. So what we're going to do today is Deb is going to talk us through understanding what kinds of rashes we, may be allergic rashes. I'm really, really being tongue-tied today, but that's okay. That's all right. Maybe I should just stop talking and you should just start telling us about allergic rashes. I figured out the problem. I keep on going to say allergic reaction, not rashes.
Yeah,
that's
exactly.
the issue. No.
Look, I think, Sarah, unfortunately, I'm not going to be able to say it's this one rash can be from this one thing. And I think that is what causes a lot of confusion with allergic rashes, because they really can present as a multitude of things. And I'll give you the most common examples, but before I go into what the rashes can look like, I think it's also important to step back and go, well, what can actually cause them? Because that's part of the management plan, right? Is obviously going to be avoiding whatever's bringing this allergy on. So I guess looking at it in broad categories, one of the most common ones is going to be, so I've got both my dogs around. I'm at home today and I'm just kind of watching them running around, and we may get a little bit of barking. So I apologize for that.
That's all right. That's all good.
Including a puppy. So maybe we'll bring her on later for a bit of light relief.
Yes.
Okay. So as I said, in terms of allergies, by far the most common things that we will see are either ingestion, so from foods or other elements, or contact. In other words, what's coming onto the skin can cause it. What your child is exposed to in the environment. House dust can often bring on skin rashes.
Yes.
That's actually quite common. And then other things that they may take, and not just food, as medication as well. Sorry, I didn't mention that. So I guess, it's looking at, and what I often talk about when I talk about, my protect, and for those of you who know me, I do practice very holistically, and I've got this 5P approach. I call them my 5 to thrive. And the fifth one is protect. And under that, I talk about the environment and the insults that our children have, and what our three main barriers are. And our three main barriers are skin, lungs, and gut. And that's kind of how we're exposed to allergens as well. So I've said skin, it's what's topical, what's going on you. Lungs is what you're breathing in, and gut is what you're ingesting. So I think that's probably the best way to look at, well, what could be causing it.
Yes.
And then there's also the other one for allergic rashes, and very common cause is actually viral infections, which can cause a lot of anxiety about and stress about it, because your child will just suddenly pop up with this classic allergic rash, which I'll show you in a second, and you're going, what could it be? And you're trying to go through all these things. What have they eaten? What have they been exposed to? But it actually just turns out to be the body's response to the virus they've had. And typically it'll be when they're getting better from the virus. So it's not usually when they're in the real depths of it with the high fevers and the snotty noses or coughs, but it's when they're getting better. And that's often when we'll see this typical allergic rash coming out.
Yep. And that's certainly what's happened in our household twice. My oldest daughter has had the urticaria or allergic rash after as she's getting better from random viral infections. And the other time has been in reaction to topical things such as washing powder and sunscreens. So they're the two things.
Sunscreen's a big one, actually. Yeah, and I don't know if you remember, Sarah, I'm sure it was in our days when we were working together in the emergency department, we'd sometimes get children coming in with allergic reactions to shampoo as well, or even like hair dye, if they've been doing like funny hair day or something, and they come in literally with this like red, swollen scalp, which has really been quite awful for them. So shampoos and stuff are another one. So I mean, in terms of, let's just talk a little about contact first, then, and I think we'll go through it that way. And then at the end, I've got some images to show people. But I think it might get a bit confusing if we're flicking between the two.
Absolutely. So do stay on, because we will be showing pictures that will really help solidify everything that Deb is talking about today, because a picture really does speak 1,000 words. And if you do need to jump off, remember, this is being recorded and you can access it on our pages at any time.
Yeah. So, contact dermatitis, which is another way of just, that's kind of like the formal term, and that's really just inflammation or reaction to the skin of whatever's gone on to it. So like, exactly as Sarah said, I'm not going to go through that again. And that's often quite easy to pick up, because you can see the pattern of it, especially, I guess, a common thing would be something like nickel as well, and there may be a piece of jewelry and you can see the outline of it, or, you've done a patch test with a cream, which we should be doing on our children and on ourselves, I guess, and it's just that area, so the pattern is very suggestive of a contact. In children and young children starting solids, the classic thing that I will see is around the mouth. And the same for drool as well. So children can definitely get this redness around their mouth. I've got an image of that, the spotty, dotty, and then you start questioning, is this eczema? Is this not eczema? And to answer that question, you've got to take a step back and look at the child beyond just that little rash, because you've got to look at the family history. Is there a history of eczema? You've got to look at, is this coming and going, and is it anywhere else in their body? So, that's just will be one clue as to whether or not it will be eczema, but it can be very, very difficult to tell the difference. And the important thing to note is that if your child, when you're starting solids, gets those spotty dotties around the mouth, and I will show you an image, it doesn't mean they're allergic to the food. That's a very different type of allergy. Yeah. So persevere and keep giving that food, because the different type of a rash, which is more the swollen, raised red, also known as hives or urticaria, that one is the more concerning one. Yeah. And I'll go into that in a second now. So you've got your topical skin. The other thing I want to mention as well with allergic rashes is insect bites. Because not only can children have a local reaction to where the insect bite was, and then you'll see a lot of redness, swelling. My one daughter gets that. There you go. I've got a personal story at long last. Yes.
It's not just me.
So at the local area, but it can also be around, which can be very confusing. And there's something called papular urticaria, which basically means that children get these little papules, which essentially is just a bump that you can feel in the skin, with or without a blister, it scattered on their body from an insect bite. So it doesn't mean they've had hundreds of insect bites. It's just that their body is reacting in that way. Yeah. So that is the skin part. I think, the air part is not as important as the skin and the gut. So I'll just briefly say that, certainly things like house dust mite can not only flare up eczema, but also just cause a dermatitis, which is an inflammation of the skin. And that's because you both are breathing it in as well as it becoming in contact with the skin. So the next big one is obviously ingestion. Classically, we're going to be talking here about something called hives or urticaria. And this is a rash that once you've seen it, you know exactly what it looks like.
It's so true.
Yeah, it's typically a bigger. So when I was talking earlier about the spotty dotty one, you're talking about small little spots essentially. This one typically is a bigger area. It's a ring. It's red around the outside, sometimes paling on the inside. And it almost seems to move. It seems to come and go, not necessarily as you're watching it there and then, but like over the hours, it comes and goes. So it waxes and wanes, and it's itchy. And it can be quite swollen. And these type of rashes, you can also get associated with something called angioedema, which is actual swelling of the skin. And those are exactly swollen around the eyes and around the mouth or even the tongue. And this is when we start to get more concerned that this is an allergy that's going to progress to respiratory problems. And I do have pictures of that. The swelling though can also be from contact. So it all kind of overlaps. I've tried to make it a little bit easy to try and work out, but in reality, what we do is, we look at the rash, we say, yes, this is allergic or not, and then we kind of try and go through, well, what is it from? And we take it from there.
I do think that one of the things that is definitely highlighting is that there is just so much. There's so many different types. There's so much that really taking a photo of it is important in case by the time you get to the doctor that it has settled down as well. So taking photos so that you can actually show your doctor, making an appointment to see them. Or if you are concerned that this is something that is, affecting your child in, with their breathing, I'm sure Deb will get into that in a sec about what to be really concerned about, that you actually do get urgent medical help too. Because, what we're talking about now is arming you with information. At the time, you don't need to diagnose it. You've got to seek medical help.
Yeah, exactly. Well, why don't we just mention those things now, Sarah, in terms of when do we come, when does an allergic reaction become an emergency? I guess that's what we're talking about. And certainly, the swelling of the face is always a concern for me. If their voice changes, so if their voice becomes a bit hoarse, if they start drooling, these are all indicating that there's swelling going on here. If you can see that they're struggling to breathe, they're really working hard, sucking in here, sucking in under the rib cage, you may even hear a wheeze. If they start to profusely vomit and complain of intense tummy pain, and obviously if they start to become floppy or their level of consciousness decreases, this is an emergency, and this is when you're calling an ambulance.
Yeah, absolutely. And I think this is one thing that we really need to point out too. So we're talking about severe allergic reaction here or anaphylaxis, that you don't actually have to have a rash at all to have anaphylaxis too. And I think that's a really important point, because I've had some parents whose child has had their first anaphylaxis, like they haven't had one before, and they're going, whoa, they just became floppy and pale, and so I called the ambulance, but I didn't realize it was a severe allergic reaction or anaphylaxis because they didn't have a rash. They didn't have any of that. I thought you had
no external clues. Yeah, totally. Yeah,
exactly. Yeah.
Do you think we should flick to some photos now, Sarah?
Great idea, I think, definitely, and that will help. I think that'll help a lot to identify some of the things that you do need to be looking out for. So remember, we're just showing you the flags, and then you, looking at your child as a whole, can then make a decision about what type of medical help that you need to get at the time. And if you're unsure, you need to just ring. If you're thinking, oh my goodness, I'm worried about my child's breathing, then you're calling an ambulance. You can always, if they're okay, they're still breathing well, it's not, an emergency, call Health Direct, and they can help guide you as to what you need to do. So in New South Wales, it's Health Direct, Nurse on Call in Victoria, and 13 Health in Queensland and some other states. So make sure you know in your state what your telephone advice line is, because they can be really, really helpful as well, especially if you're unsure.
100%. Okay, let's look at some pictures.
Okay.
If you can see my screen, Sarah, let me just.
I can. So if you're happy to play that, you can go.
Yeah. Okay. Good old Canva for those of us.
Brilliant. And just so where we've gotten these pictures from, so from DermNet New Zealand, and also don't forget Bubble Skin Deep. So there are great resources out there where we've pulled these from the internet.
Mm-hmm. So this is that spotty dotty rash that I was talking about around the mouth. Often when children are starting solids, you can see this little one's got a snotty nose. So it could just be from the snot saliva sitting around their mouth. And this is often a drool or dribble rash as well.
Yep.
Is another one of the same, just less.
Yep.
This area on this area here, you can see there's a little bit of brown here, and I'm not sure if that's just snot that's tracked down and tried, or whether there's any signs of secondary infection. Just to mention something, if your child suddenly develops that kind of an appearance, they should be looked at to see if there's a secondary bacterial infection, because that could be the beginning of something like a school sore or staph infection. That golden color. Okay.
Yes, that lovely impetigo.
And I've done a few because it is so common. And also, can you see this little one is his cheeks are also red?
Yes.
And I guess this pattern would make me wonder a little bit more whether or not this is a bud that's going to go on to eczema. And you can see this is like dry. It looks like quite scaly as well, which would again suggest more eczema, but a little bit of more of the history and examination and time will tell.
Yep.
So now this is your classic urticaria or hives, and as you can see, it's this kind of big patches, different sizes. Some of them you can see, like this one you can see is a bit paler in the center, and this would be a very itchy rash. And if you recall, I've said this can either be from being exposed to something they're allergic to, or very commonly also just as a reaction to a viral infection.
And Deb, this rash can actually move around, can't it? It
yes,
doesn't
that's what I said. Yeah. I said that earlier about how it seems like it can move, it waxes and wanes, so it comes and goes. And, things that can make it worse is the heat. So if a child does have a rash like this, what we would usually recommend is keeping your child cool. Just a single, like as you can see, a singlet on, certainly not hot baths because that can flare it all up. And this is, again, urticaria on darker skin. As you can see, it's a little bit trickier to tell, but you can see it a little bit clearer over here, perhaps. But it's raised as well. And I don't know if you can appreciate that in a photograph, but it will be raised, so you can actually feel it too. This is actually contact dermatitis, and you can see it's like a funny pattern. Can you see that? I don't know what was on their arm, but it's like you can see there's like a line here, and it's like a squared off. So whether it was, a sticker, a Band-Aid, quite commonly happens with a Band-Aid, or a temporary tattoo or whatever other things kids put on their skin. And this rather dramatic looking one is actually from sunscreen. Which is exactly, swollen, inflamed, very puffy there, and looks quite tender too. And that was a reaction to a child putting sunscreen on her face without any, patch arm testing.
Yes.
So I think that's a good lesson. And, how can you tell this is not angioedema? Well, I wouldn't expect you not to be able to tell that. I would be suggesting, please, take your child in to be seen urgently, or at least call Health Direct for further information. But you can kind of see the line here, and there's nowhere else in her body, and there were no other symptoms or signs for this child.
Yeah. So remember, do look at your child as a whole as well. That's an important thing. But the other thing too is sometimes.
Sorry, Sarah, before you jump in, this is my last slide. So do you want to go back to our screen?
Yes, no problem. Here we go. There we go.
There we go.
Got us again. So what's interesting is that sometimes it's not necessarily a new product. It can be a product that that you or your child have perhaps used before. So I did this not so long ago because I am a bit of an allergic type of person, and I used a face mask, which I never do. I hadn't even touched one in about 2 years. I used a brand that I used to use like before I have kids, because I'm pretty sure that's the last time I did anything to my skin. And I put it on and I went, this doesn't feel quite right. And I'd used that particular one so many times. I'd bought it new, but it had been a long time. And I put it on. I felt, oh yeah, no, this doesn't feel good. It just felt awful. It started to be itchy. I washed it off and I had slight swelling, certainly not like that girl, but everywhere it was, I was
Red.
bright red. I took a photo of it. I should actually post it to say, always patch test, but I didn't to patch test it because I'd used it before. Anyway, I did have this lovely reaction to which it was a great source of entertainment for my children. They thought it was hilarious. But, I really, solidified that fact. You know what? I should actually patch test first. And I looked at the ingredients and some of the ingredients had actually changed. It had been quite. So that's one of the things that we need to be aware of is have a look, have the ingredients changed in there, and remember to patch test. Okay, really do it. It'll save you a whole lot of angst and red skin. Do you want actually, Deb, while we're here, do you want to just in case people are unaware of what patch testing is, do you want to just spend 30 seconds on where you should patch test and what you should do?
Well, the recommendation is usually on the arm, the upper arm, the forearm, anywhere on the forearm, I guess. So, and you're meant to do that and leave it actually for a few days, ideally.
Really?
Yeah, because sometimes the reaction can take a few days, but certainly I would leave it on for a few hours before applying cream. So it's kind of like the day before. If you buy the cream, try it that day and then anticipate using it the next day is probably the most practical way of looking at it. Yep. What would you say, Sarah?
Yeah, absolutely. And I would also, I spent a fortune on different sunscreens. Like it was really ridiculous. Patch test your kids when you go to the park with your mum friends or your dad friends.
Exactly, using other people's cream.
Use their cream, patch test it on your child, and then you'll know and you won't waste money buying that product and then having to give it away.
Yeah, so, and just remember which spot is which cream.
Yes, exactly. Don't do 10 different ones and forget which one it was. Do one at a time for simplicity's sake. Because I don't know about you, but my brain's full of stuff. I don't need to remember.
Totally.
One at a time. One at a time. Right. Yeah. Okay. So is that everything that you wanted to talk about today?
I think so. I'm happy to take some questions if there are any. Otherwise, we'll wrap it up.
I'm just really excited that we have Prasanth joining us from India as well. We love that we are getting around the world. I hope that this has been useful for you. And remember, we have got a whole library of videos as well on our Facebook pages. We've got our Instagram as well. So please come and join us there because we've got lots of good health information. But what we want from you, please, is let us know what you want us to talk about. Okay, so pop it in the comments below, direct message us, whatever you need to do to contact us, let us know what you want to talk about and we will endeavour to get there. We're going to continue on the theme of skin next week. So we will see you at 10 a.m. Sydney time next Wednesday. And yes, that's where we'll go. But we do have a question from Nikki. Okay, Nikki has said, what is the difference between dermatitis and eczema?
Eczema is a type of dermatitis. So dermatitis is just a fancy word for skin inflammation. And so eczema is a type of skin inflammation. It can even be called atopic dermatitis, contact dermatitis, but it's not all dermatitis is eczema, but all eczema is dermatitis.
Okay. Thank you, Deb. Fantastic. Wilbur has said, oh, you can hear the dogs barking where I am.
Your dogs.
Yes. So we've got the office dogs here in the CPR Kids office, which is quite lovely. So it's a good thing. Wilbur has said hi, Wilbur. I know that you've been watching a few times. Hopefully this has been helping you with the little kids in your life as well. But we will sign off for the day if there aren't any more questions, and we will see you again next Wednesday, 10 a.m. Sydney time. And remember, bring your questions questions and tell us what you would like us to talk about. Okay. Thanks so much, everyone.
Thanks,
We'll see
everyone.
you again.
Bye.
Bye.